fascinating thing about child and adolescent psychiatry is that you're dealing with developing individuals. And we know that this development has to do with genes, it has to do with brain development, it has to do with interaction with the environment, it has to do with neurocognitive aspects, and it has to do with gender. And the beauty of it is that development does not start when you become an adult, stop when you become an adult. It goes on all your life. Every day your brain is forming new networks of knowledge, of experience, and what I'm very passionate about is to introduce that notion of development into adult psychiatry, and that's happening. One of the things that happened here in Vienna is that a section on neurodevelopmental disorders has been created that acknowledges that people do not have child and adolescent conditions that stop once they're adults, but that it continues and that they should be acknowledged for and cared for in a proper way. I think that the whole idea of development, the whole idea of brain, gene, nurturing environment within the context of gender is, for our scientific progress, absolutely crucial, because many of the illness concepts that we have as psychiatrists may be wrong. Maybe there's nothing such as autism or schizophrenia. There are kind of conditions that could be called like that, but when you look at endophenotypes, when you look at genotypes, you realize that there are many commonalities, and we're only at the verge of beginning to understand how in one individual certain circumstances from the environment will lead to a depression, whereas the other one is going to be psychotic, whereas the other one is going to have problems in relating to others. And that is very important from a point of view of science, that we have an open mind to what is really causing mental problems, but it also impacts on our clinical practice. We cannot see people as confined to categories that we've defined. We should see them as individuals, diagnose them properly to make programs of rehabilitation, of treatment, of guidance that are tailored to their individual needs. And I think that's absolutely crucial, and that's really the importance of child and adolescent psychiatry. And I'm very happy to see that within adult psychiatry the notion of development has really developed over the past decades, and that we're now seeing that also in the psychiatry for the elderly, development takes along with devolution. So that this whole notion of nature, nurture, environment interactions is at the core of psychiatry.